How does a spirometer detect restrictive lung disease? Imagine trying to fill a balloon that just won't stretch fully. That's similar to what happens in restrictive lung disease. A spirometer is the tool doctors use to see how much air your lungs can hold and how quickly you can breathe out. It measures two main things: the forced vital capacity and the forced expiratory volume in 1 second. The forced vital capacity is the total amount of air you can forcibly blow out after taking a deep breath. The forced expiratory volume in 1 second is how much air you can blow out in the first second of that effort. In restrictive lung disease, the lungs can't expand fully, so the total air they can hold is less than normal. When a person uses a spirometer, their forced vital capacity is lower because their lungs can't fill up as much. Both the forced vital capacity and the forced expiratory volume in 1 second tend to decrease in this condition. But here's the interesting part. The ratio of the forced expiratory volume in 1 second to the forced vital capacity usually stays the same or even gets a little higher. That's because both numbers go down proportionally, unlike in other lung problems. This pattern helps doctors tell the difference between restrictive lung disease and other issues like asthma or chronic obstructive pulmonary disease. In asthma, for example, the forced expiratory volume in 1 second drops more than the total capacity, making the ratio lower. But in restrictive disease, the ratio stays normal or increases because both values decrease together. So, when a spirometer shows a low forced vital capacity but a normal or high ratio, it points toward a restriction in lung expansion. This means the lungs are physically limited from filling up fully, not just blocked or obstructed. Sometimes, if restrictive lung disease is suspected, doctors will do extra tests like measuring lung volumes or how well gases diffuse across the lung tissue. These additional tests help confirm the diagnosis and understand the severity. Using a spirometer in asthma management is mainly to see how well the airways are functioning and if there's any obstruction. But it can also reveal if a person has a restrictive problem that might be hiding behind or mimicking asthma symptoms. If the spirometry results suggest restriction, your doctor might look into other conditions like lung scarring or chest wall issues that could be limiting lung expansion. Overall, a spirometer is a simple yet powerful tool that helps healthcare providers see how well your lungs are working. It guides treatment decisions and helps track changes over time. Whether you're managing asthma or checking for other lung problems, it's an important part of monitoring lung health.